Welcome back to the Industrialized, Interoperable, and Insight-Driven Federal Health Panel, sponsored by Accenture here on federalnewsradio.com and 1500 AM. I'm your moderator, Tom Temin. Our guests today are Dr. Bart Harmon, the President of Clinical Informatics Experts, Stan Huff, the Chief Medical Informatics Officer of Intermountain Healthcare, Dr. Kaveh Safave, the Global Managing Director for Health at Accenture, and Jim Traficant, the Managing Director for Accenture Federal Services and the President of ASM Research. And I wanted to ask about what's going on in the legislative and policy and legal environment. We have the still gelling Affordable Care Act. We had recent legislation that tries to overhaul and fix some of the problems evidenced at VA. Does any of this really help the issue that we've been talking about, which is interoperable, industrialized, insight-driven healthcare, or do they beg the issue or do they hurt the issue?
I would say indirectly, in that you're not going to be able to expand health insurance coverage or lower healthcare costs without addressing the means to that end. They're not those specific bills, for example, were not designed through legislation to solve this problem, which predates the legislation and will be a work in progress for a decade. But to the extent, for example, that it creates a business environment and an economic environment where incentives are aligned, as Stan talked about, that it's more likely to be aligned than it was previously. But there's a lot of work that has to be done. Certainly, the White House, through the Office of the National Coordinator, has attempted to serve in a convening role, bringing the stakeholders to the table in an effort, again, to continue to try to push this alignment. There are private sector initiatives underway in order to try to get agreement on language and terminology, because remember, you can have two systems that connect to each other, but if the language spoken by the two systems isn't the same, then you can't get to the insights that you're looking for. So that concept of semantic or meaning level interoperability requires fundamental agreement by everybody to speak in the same language. And that's a process, because everybody comes at, just like we don't all agree as citizens to speak the same language for reasons that make sense to us. You can't just wish that to be the case. It has to work its way toward that case. So I think, there are a lot of parts there, and everyone has a role to play. And I think to the extent that some of the legislation creates the right environment and context, that's a good thing, but it's not by itself not going to be good enough.
Now, Jim, at the VA, part of the problem was variability, because I think when you look at VA, it's almost like looking at a chiaroscuro, black and white organization.
Sure.
In many ways, it's considered the best deliverer of certain areas of healthcare, certain regions people clamor to get into, and yet you had all these problems that made the headlines in other parts of VA. So do you see what's happened with legislation and then now the overhaul plan that is just being hatched by the new Secretary, Bob McDonald? Will they help that issue of variability in care, which is also the goal of this interoperable, industrialized kind of data environment we're also looking at?
The answer is yes. I think the legislation, what it does, it sets a mark on the wall. It drives a stake and says, this is what we want to have in terms of a result. And they're not prescriptive in terms of how we get there. I think the Secretary's strategy, is on point with my VA and putting the veteran at the center of everything that the VA does. And I think the variability that was identified in the DOD study commissioned by Secretary Hagel identifies, look, there's places where we deliver great care, but it's not consistent across the whole enterprise and at all levels. So there are things that both DOD and VA are attempting to drive out variability, improve the quality of care delivery, and get towards this insight-driven model. And I think they're to be commended for that. And I think the legislation is useful in setting the mark. The second point I would make on the legislation is the great opportunity that DOD, VA, and the federal government at large has to set the table for the country in terms of where are we headed and how do we get there. And Kaveh mentioned the Office of the National Coordinator, the opportunity to set standards so that it is understood how are we going to communicate, what are the standards-based models that we're going to embrace to drive this connected framework. And then DOD, again, with General Robb saying, look, we're going to lead the nation on interoperability. It's foundational to our mission, and this is a great opportunity for us to step up not only for the good of the force, but for the good of the country. And I love also what Secretary McDonald's doing around My VA to drive the same thing. I think we've got great leadership in place, a great vision, and now we have to execute.
So this could be the best thing since Blue Button.
I think so. I think we have an opportunity to go make a difference here, and the forces have aligned for that outcome. I'm excited about where we're headed.
All right, and Dr. Huff, you said that your organization insures 800,000 people.
600,000.
600,000 people. Yep. They don't all go to the same 3 doctors. And so what are some of the private sector best practices for using data in such a way that you can help drive down variability and increase quality across the board?
So, we put in an infrastructure that essentially all of our patients are in the same database. So, we have the luxury that a lot of places wouldn't have, because we have the ability to have a single electronic medical record that spans both the inpatient environment and the outpatient environment and makes the record available anywhere the patient is seen. And so that's a big advantage. But thinking about the larger question and the government's role, I mean, I second the things that are certainly agree with the things that have been said. I love the focus now on interoperability, because my experience with meaningful use and the other things have I guess would be summarized by sort of the rule of unintended consequences. From our perspective, from I think Intermountain's perspective, what we really love is this focus on interoperability and standards. And I think the thing that the 1 or 2 other things that need to be coupled with that are aligning incentives, which in a lot of ways we think happens because you hold us accountable for quality rather than for specific measures. And I could go on at some length about unintended consequences, but what I heard one gentleman say was that the measures that were instituted made us focus on managing measures and not managing quality, and I think that's a very true vision of what's happened with sort of meaningful use measures. And so I'm excited to see the focus on interoperability and away from prescriptive certification criteria and prescriptive measure reporting.
So one of the hazards of too much data or the wrong approach to data maybe is confusing outcomes with causes.
You start out with really well-intended and reasonable sorts of things that, working through the bureaucracy and the certification process, end up doing things that interfere with workflow, that interfere with physicians. And a common cry within Intermountain Healthcare is, when are you going to make my life better? What you've done with all of the things that you've done so far has actually cost me time in how much time it takes me to take care of patients, and for no real benefit in terms of quality for the patient or in the patient experience itself. And so I think you're exactly right. I mean, we need to think about give people the opportunity to improve workflows and actually improve work for the frontline doctors, rather than thinking so much about billing and measures and process things that really are not adding value to the healthcare environment.
So, Dr. Harmon, do you agree that that some of the variability can be driven out and quality raised if data is used effectively? And have you seen evidence of that?
I believe it can be, yes. And what's key is to have balance in the priorities of health enterprises, not only locally and regionally, but nationally, and good understanding of what's being compromised against what constitutes a good outcome for a health enterprise. And how do we pursue that so that we don't destroy the provider's ability to deliver the care? Do we put so much attention on the structured data for the measures that we destroy the workflow of the provider? Do we put so much emphasis on structured data collection, and there are some experiences along these lines, that you end up with clinical notes that are almost unreadable because the data making up the note is unreadable? And so balance in terms of, as we decide what matters to us and what we'll pursue and what we'll invest in, looking at all the different impacts of the decisions that are made and not focusing on 1 or 2. Because if we focus on just 1 or 2 desired outcomes and don't pay attention to things that might be de-optimized by decisions, we can end up doing almost as much harm as good by making changes. So I think balance across multiple interests is really important.
And Kavi, one of the variables in the system is the human being at the center of it. You know, the same argument has been made in, you know, car safety. The engineers say we can make any part safe except the nut behind the wheel. And so in the case of delivery of medicine and medical services, if everything is reduced to data, is it possible that the individual that has some slight variation that would, say, trigger intuition in a healthcare provider, a doctor, might get trampled underneath the data aspect of it, such that in some cases healthcare could get worse?
I think what you might be alluding to is if we convince ourselves that there are simple rules and then we try to apply the rules to everybody, that would be a problem. I think we already know that. And the reality is that the human body is quite complex, and for all the research we have, the amount of real understanding we have of how the human body works is pretty small. We make a lot of inferences, a lot of guesses. Even when a drug is approved, it's not approved because everyone who took the drug in the trial got better. It's because most of the people got better. But some might have gotten worse. We still don't always know who that is. So the information is really the basis upon which judgments are made. Some of the judgments, there is a large body of information to support, and some there's a weak body. And I think we know at this point that it's ultimately going to be, what you really want is an informed healthcare provider. If you don't give them the information, then there's no chance of them making the right decision. If you give them as much information as is possible, then the likelihood of a good outcome goes up.
All right, so getting back to the federal issue here and DOD and VA, Jim, do you think that the government now is positioned to provide the kind of leadership that maybe only the federal government can to bring all of this along in such a way that we start to develop this national system?
I think we're in a very unique place in time where we have the opportunity with both DOD and VA modernizing at the same time and attacking an issue of national priority in healthcare, cost, access, and quality, and have demonstrated and committed to leading in helping to fuel the transformation. I could tell you that for me personally, this is it's like a remarkable privilege. I had a veteran save my life in a living donor liver transplant 15 years ago. I've gone from not knowing if I'd have another day to live to having the privilege of serving inside of a transformative model to make a difference and help take care of those who've taken care of us. And I think as a country, it's a great privilege. And for me personally, it's an honor. So I love the leadership we have in place. I love the mission that's been set, the mark that's been set on the wall. And I love waking up every day to go attack it.
All right, well, I hate to take this back down to the more technological level after that stirring story, and it truly is. But I wanted to ask Bart, what does the technology need to do in terms of records, electronic healthcare records? Where do they need to go? And this whole meaningful use idea, what do they need to be so that meaningful use can occur in some way that makes sense for the practitioner?
I believe this gets back to the topic of balance again. We have to look at what are the impacts to the workflows of different providers, different types of providers, different members of the broader healthcare team, to make sure that when we're doing things and making changes, we're doing things that make it easier for people to do the right thing as they're doing their job and to get through their day getting their job done, and not making it more difficult for people to take care of patients. So we have to make sure that we're not letting the EHR get in the way of healthcare just in the name of capturing better data. And at the same time, we need to be looking all the way at the top about what matters to us as health enterprises, as individuals who receive healthcare, and as a nation, with cost, quality, safety all in mind. And all those different dimensions have to be considered at the same time in a formula that's a little bit complicated, to make sure that we're not breaking three things when we fix five other things, because there's a risk of kind of the pendulum going back and forth between fixing different problems and breaking the thing we just fixed as we react to new data that's coming in. And in my mind, that's what's important, is balance, a bottoms-up perspective in conjunction with a top-down perspective. So we're really trying to think through the consequences of changes and improving in slow, steady steps, and not trying to make big swing changes that might break things.
And Stan, so it seems like many of the records now take the tax form approach, where there's a comprehensive type of form, but really maybe the future, and you tell me, is it in voice input? Is it in direct sensor input that the doctor might be using to the form, and not so much data entry as it classically takes place by either the doctor or somebody else in the room?
There's a tremendous opportunity with wearable devices and personal networks and those activities, because, think about something like managing hypertension. It's now possible basically to continuously monitor someone's blood pressure, and you have a much better idea of what their base state is, as opposed to some number of measurements that you make in the office, and they might have white coat, sort of anxiety that, doesn't really represent what's going on. And so, there are all kinds of devices that offer a great opportunity. There's swallowable devices, there are nanotechnology. I mean, it's an incredible opportunity for those kinds of devices. And so that is a wonderful opportunity. And I guess the other thing that I would just mention is that I think is essential with all of the emphasis and on interoperability and the opportunities that we have, is that we not create unrealistic expectations about how fast things can happen. I've again, just sort of from my own experience, I see too often that we get excited and we get in the situation of, trying to make a 6-month baby. There are things that we need to put in place that take time, and the government leadership, I think, I hope they're thinking in terms of building a foundation that may take us 5 years to build, but then will benefit us for decades.
All right, so good place to end at the beginning of the journey. I'd like to thank today's guests, who are Dr. Bart Harmon, the President of Clinical Informatics Experts, Stan Huff, the Chief Medical Informatics Officer of Intermountain Healthcare, Dr. Kaveh Safavi, he's the Global Managing Director for Healthcare at Accenture, and Jim Trafficant, the Managing Director for Accenture Federal Services and the President of ASM Research. I'm Tom Temin, federalnewsradio.com and 1500 AM.